Hello, my name is Blair Taggart, and for our group project, we were given Clark County, Arkansas.
And I'm TJ Gamble.
I am Tiara Holland, and we're presenting this along with Sochill Shields.
A little bit of background history on Clark County. Clark County was created on December 15th, 1818, as part of the Missouri Territory. As one of the 5 original counties that composed the Arkansas Territory when it was established, Clark County included all or parts of at least 15 current-day counties in Arkansas and at least parts of 6 counties in present-day Oklahoma. The county was named for the Missouri Territorial Governor, William and Clark, which you may know from the Lewis and Clark expedition.
For demographics in 2018, there were about 3 times more white, non-Hispanic residents in Clark County than any other race or ethnicity. White non-Hispanics represented 68.9% of the population, followed by Blacks or African Americans, who represented 24% of the population. Those who identified as white or other with a Hispanic ethnicity represented a little over 2% of the population each, and those who were multiracial reflected 1.3% of the population, and those who identified as Asian, American Indian, or Alaska Native, and Pacific Islander represented about 1.1% of the population.
So, poverty by race and ethnicity. As of 2019, there were about 21% of the population in Clark County that were living at or below the poverty level. The most common racial or ethnic group that lived below the poverty line in Clark County was actually whites or Caucasians at about 50%. They were followed by Blacks at about 28% and Hispanics at about 12%. All of the other classifications of racial and ethnic groups made up approximately 10%. So healthcare access in Clark County. According to the U.S. News Report, Clark County scores only a 51 out of 100 in terms of access to healthcare. There are only 4 hospitals in Clark County, those being Baptist Health Medical Center, Clark County Health Center, and Clark County Memorial Hospital, and all of those are in Arkadelphia. So even combining all of the beds at those 4 hospitals, that still only allocates about 1.1 beds for every 1,000 residents. This will be touched on a little bit more in the upcoming slides, but the ratio of primary care providers to population is 1 to 2,206. About 91.4% of the population has healthcare coverage, with about half of those being on employee plans. Around 19% are on Medicaid and about 11% on Medicare. 12.7% are on non-group plans and about 1.5% are on military or VA plans. As I touched on earlier, the patient to clinician ratio in Clark County is kind of a stark statistic. About 2,206 to 1 primary care provider. This is actually a decrease from previous years. The statistic used to be 2,229 patients for every 1 provider. So we're seeing growing trends, but there's certainly much progress to be made. There are 2,029 patients to every 1 dental provider and 360 patients to every 1 mental health provider. So just some health disparity fun facts. As I mentioned earlier, about 91% of Clark County has healthcare coverage, with about 47% of those being on employee plans. 18.7% are on Medicaid, 11% on Medicare. And building on that fact that there are 360 patients to every 1 mental health provider, I just wanted to touch on some of the mental health disparities in the state of Arkansas as a whole. Arkansas has the 2nd highest incidence of adults with major depression. In 2016, Arkansas actually had the highest incidence of adults with serious mental health illness. About 5.4% of that population was affected. So healthcare spending in Arkansas, there are about $7,408 per capita spent on personal healthcare in Arkansas. This is broken down further into about $6,108 per enrollee being spent on Medicaid, and about $3,906 were spent per enrollee on private health insurance spending. Healthcare coverage in Arkansas, we've touched on this a little bit about the 91.4% being covered, but that also leaves 8.64% of the population being uninsured. Of those who are covered, as we've mentioned, about half of those are employee, about 19% Medicaid, and about 11% Medicare. But this uninsured population has actually decreased in the last few years since the enactment of the Affordable Care Act. So as you can see in this graph, between 2013 and 2018, the percent of uninsured citizens in Clark County has declined about 7% from around 15% to the current 8.64%. So healthcare equity in Arkansas, for the next 3 slides, you're going to see these tables like I have on the right. Those are tables made by the U.S. News Report, which provide a score out of 100 for various categories like health equity, health behaviors and conditions, and healthcare outcomes. So equity as a whole includes categories like access to healthcare, income, education, equality, and several other things that determine how well all members of the community are afforded the opportunity to live a productive and healthy life. The Neighborhood Disparity Educational Attainment Score, which is part of that equity category as a whole, is 14.28. This is actually 5 points higher than the national average of 9.29, which means that in Clark County, there's a larger gap in educational attainment. Healthcare equity, which is what we're focused on, actually gets a score of 77 out of 100. It includes environmental risk, like you can see in the table to the right, and they're all fairly close to national averages. Income equity, which is measured by the Gini index score, is 0.43 in Clark County, while the national average is 0.44. So in Clark County, we're not seeing a huge gap in various income wages. Health behaviors and health conditions. For health behaviors, Clark County scores a 20 out of 100, and for health conditions, scores a 46 out of 100. A lack of healthy behaviors like good nutrition among several of the individuals in Clark County has led to a number of prominent health conditions that affect their population. Among individuals who are covered under Medicaid, only 11% of them have actually had a primary health care visit in the last 12 months. Also, there are only about 4.4 local food outlets for every 100,000 residents. So not many options of places to get those healthy and nutritional foods. The average household expenditure on healthy foods is around 12% of their income. And as you can see from these graphs at the bottom, about 20% of the population in Clark County smokes. Nearly 500 out of every 100,000 are diagnosed with some form of cancer. And about a fourth of the population are covered under Medicaid, and those who are covered under Medicaid are likely to be diagnosed with heart disease. Some of the other fun facts, about a fourth of the population is obese. Around 15% of the population has diabetes. There have been 147 people who've been diagnosed with HIV and 816 other diagnoses of sexually transmitted infections. So health outcomes in Clark County, like we saw in the previous slide, there are a number of serious health behaviors and conditions that are prevalent in Clark County, which have all led to not great health outcomes. Their score from the U.S. News Report is a 47 out of 100. Various factors like racism, poverty, living in certain neighborhoods, gender, and stigma are all things that contribute to those poor health outcomes. So just some statistics. In Clark County, there are higher rates of adults in either poor or fair general health than in the U.S. as a whole. There are also more babies born at low birth weights, which overall leads to poorer life health outcomes. The life expectancy in Clark County is 2 years lower than the national average, but however, one of the statistics that they have going for them is that their rates of teen pregnancy are less than the national average.
With looking at the implications of the Affordable Care Act in Clark County, we're here to remind ourselves of their 3 goals, which is to make healthcare available to more people, to expand the Medicaid program, and to lower the overall cost of healthcare. The Affordable Care Act helped to establish the health insurance marketplace, which is a platform that displays different insurance plans and prices for individuals, families, and small businesses to price insurance. Since the enactment of the Affordable Care Act in 2013, Clark County has had almost a 7% decrease in the proportion of the population that is uninsured. This has led to an increased access to healthcare and a more equitable healthcare system. With the ratio of primary care providers to patients already being so large, more access may mean less availability and longer wait times. In Clark County, there are 2 health insurance providers and 7 health insurance marketplace plans. The 2 health insurance providers are Qual Choice Health Insurance and Arkansas Blue Cross Blue Shield. Each tier and each plan offers a different percent covered of expenses. For example, the bronze covers 60%, the silver covers 70%, the gold covers 80%, and the platinum covers 90%. With catastrophic coverage, people under 30 or those suffering from financial strain use this to cover serious illness and hospitalizations. Another implication of the Affordable Care Act is an increase in healthcare expenditure. With more people being eligible for Medicare and Medicaid, as well as the Woodworks effect taking place, there will be more frequent visits to the doctor's office. Therefore, the government is going to be spending more money on healthcare. And these next 3 slides are screenshots of the premiums that are offered for both healthcare choices in Clark County, the different tiers, and the different prices per group. The cheapest for each comes from the catastrophic coverage, and that is found through the Qual Choice Health Insurance. And again, these are just screenshots showing you the premium prices.
So for our proposed program, as we discussed earlier, the ratio of providers to patients in Clark County and the relative lack of access to healthcare is a very shocking statistic that needs to be addressed. Our proposed program would be for the Arkansas Department of Health to form a partnership with local internet providers in Clark County to allow more of the population to have access to their services. As we saw during the COVID pandemic, access to internet provides educational opportunities, the ability to work from home, and above all else, more access to healthcare. This would allow for an increase in the telehealth visits, which is especially important for the large proportion of the population that is living below the poverty line and who may not be able to afford it. As we mentioned earlier, about 21% of the population in Clark County is living at or below the poverty line, which may significantly impact their ability to afford internet services. So, as Clark County is a rural health area, this would allow residents in Clark County to also have more access to providers as well as specialists, which may not be in their area. Because this would be a public health program, the goal would be to receive funding from either the state or federal government to support the endeavors. So building off that, there are some key components to making this program functional. Those components include the partnership with the local internet providers, which we discussed, practitioners in the area who are willing and able to perform these telehealth visits. Along with that, there would need to be some training at both the patient and provider level on the ability to use these telehealth visits. And above all, we would need to find funding for the provision of the internet access. So conversations would definitely need to be had to convince stakeholders that it is really a small price to pay to allow more of their population to have healthcare access. And these are our references that we use throughout the presentation. And with that, that is the end of our presentation. So thank you for listening.